All started? Okay. Hello, my dear friends. A very warm welcome to all of you in this INI-CET rapid revision session. And this is our first question, which is on the topic of inventory management. It belongs to the topic of health planning and management. And inventory simply means drug store. So for management of drug store, we have this some methods. One is this ABCVED analysis. What is that? A stand for those drugs which are always needed. B stand for those drugs which are better if present. If not present, that is also okay, but it's better if present. And C stand for those which are kept as control, not regularly used, but just kept some special situation they might be needed. Control drug. So whenever you will have your own hospital or you are in a government hospital, first day you should make a list of those drugs which are always needed, and you should give 70% fund to these drugs which are always needed. Why? Because अगर आपने 70% फंड इन ड्रग्स को दिया तो ये हमेशा रिक्वायर्ड हैं. एक तो ये एक्सपायर नहीं करेंगे, दूसरा ये शॉर्टेज में नहीं जाएंगे, है ना. इफ यू गिव 70% फंड, दे विल देन दिस ड्रग्स विल नेवर बी इन शॉर्टेज, एंड बिकॉज दे आर ऑलवेज नीडेड, सो एनी वे दे आर नॉट गोइंग टू एक्सपायर. सो 70% fund to category A drug, then 20% drug go to category B drug, and 10% fund to category C drug. And similarly, there is one more thing, VED. VED stand for vital, essential and desirable. Some drugs are life-saving, they are vital. Some drugs are essential drug like antibiotics and all, and some like multivitamin, they are desirable. So these are the two techniques to manage drug store. Now let's come to the question. They are saying 50,000 rupees is allocated, and they are giving 35,000 for drug A category, 10,000 for category B drug, and remaining for category C. So if you see, 35,000 is how much of 50,000? 35,000 is 70% of 50,000, and 10,000 is 20% of the fund. Remaining, they said, so remaining will be around 5,000 rupees. 5,000 means 10% fund, because 5,000 is 10% of 50,000. So basically, in this question, they are saying to distribute fund in 70, 20, 10, which is ABC analysis. And if you have to make a list which category of drug you should order first, then the list should be A and V, which are always needed and vital. They should never be in the shortage. So this should be our first priority of drugs. These drugs should always be there in your hospital. So I hope you remember these two things. Now, system and network analysis, these are totally different thing. I hope you know network analysis is managing our time. It have two part, PERT and CPM. PERT is program evaluation review technique, which is a flow diagram of all the event, sequence of event which we will take. And CPM is critical pathway method, which means that the most time taking path should be given importance. System analysis, this means comparing cost effectiveness of two or more person or two or more program. Comparing cost effectiveness of two or more person or program. Okay. So what does it mean? They have asked question from this topic in this way, that let's say you have to choose one doctor among 2-3 doctors, and you have to choose them based on extracurricular activity which they are doing. So this will be example of system analysis. This will be example of which of the following? Answer is system analysis. So what do you mean by extracurricular activity? And a doctor will not perform na. Extracurricular means maybe counseling, maybe explaining drug to the patient, maybe grief relief and all those things. So extracurricular activity, if some doctor is doing, it means they are taking the same money, the cost is same, but the one who is doing the counseling work also is more effective for the hospital. So we are comparing two doctors based on their cost effectiveness. Effectiveness means how much utilizable is the program or is the person. So when you compare two doctors based on the time taken to compare two doctors or to choose from doctors, there are three parameters which you can use. First thing we can use is we can compare them based on cost effectiveness, based on extracurricular activity done. So if you are choosing them based on extracurricular activity, this is known as system analysis, which we discussed. If you are choosing doctor based on the time taken to do a specific surgery, then this is known as work sampling. And if you are choosing them based on the feedback from the past organization where they were working, this will be group method, and that will be known as Delphi method. So if you are taking based on consensus of people opinion, or group opinion, then this will be known as Delphi method. So Delphi method is a group method. Did you understand this 3 point? I hope it is clear to all of you. And if let's say there are 3 surgeons in your batch and you opened your own hospital and you want to choose one out of the 3 surgeons, and if you are choosing them based on time taken to do surgery, work sampling. If you are choosing them based on their feedback from last hospital where they worked, that is Delphi method. If you are choosing them based on out of those 3 who will help you in the marketing and other extracurricular work, that is system analysis. Now, one more good numerical question which came from this topic of inventory management is that let's say 40 patients are on amlodipine. Let's see whether you can do this question or not. This is a tough question. Amlodipine 10 mg HS. 10 patients came from other PHC and they are on, let's say, telmisartan 40 mg OD. Find amount of drug which you will order for 1 month. Amount of drug ordered for 1 month. So the point is that whenever we want to know the drug which is ordered, this has 2 components. One is what is the monthly consumption of drug, and then we multiply it with reorder factor. This reorder factor is 2 into n, where n is the number of month. For how many months you are ordering, that is the n. So let's say if you are ordering for 2 months, reorder factor will be 2 into 2 months, so it will be 4. Okay. So this will tell us the drug to be ordered. Drug ordered is detected by this formula. Now, the 4 options that was given was 1500 and reorder factor equal to 1, 3000 and reorder factor equal to 2, 1500 and reorder factor equal to 2, and then 1600 and reorder factor equal to 2. So if you know the answer, please give the answer in this in the box here. Thank you, Gagan, for appreciating. So please give the answer. Now, one thing is we have to find the monthly consumption which is there. So for monthly consumption, you just have to see that there are 40 patients amlodipine 10 mg HS. So that means 40 are taking 1 tablet per day. HS means before sleep, 1 tablet per day for 30 days. And this 10 patients, you can see here, These 10 patients are on telmisartan 40 mg OD. So this 10 patient is also taking one tablet per day for 30 days. So 40 into 30 if you will do, it will come 1200. 10 into 30 if you will do, it is 300. So the total drug that they are consuming is 1500. Now what is the answer? Sakshi is written A and C both. Okay, so Sakshi is correcting, not Sakshi ma'am from Gynae, Sakshi Sharma, our student here. So Dr. Sakshi is writing the answer as C finally, and C is 100% right, because monthly consumption is 1500. We have to multiply it with reorder factor, and reorder factor is, it is ordered for 1 month. So 1 month means 2 into 1, reorder factor will be 2. And if you multiply 1500 with 2, it will come 3000. And because it is for 1 month, so reorder factor will be 2. So this type of question can be done by this simple formula. And because it can be done orally, so it can come in your exam also. Now let's come to the other topic. In this image, which model of disease causation is depicted? So the model depicted in this photo is component cause model. In component cause model, there are two type of factors which lead to any outcome. One is the essential factors, and one is the sufficient factor. And then there are essential or sufficient are those which are always present for the disease. Like let's say I am talking about testicular cancers, Tata's cancer, and there can be many reasons for developing testicular cancer. But one thing which is most of the time, which is very commonly found, is working in coal tar factory as chimney viper. Coal tar factory viper. Okay. Second reason can be smoking, which can cause it. Third reason can be, let's say, some genetic factors can be responsible for it. But let's say in all the group of people where you do this study, if every time coal tar factory viper is one thing which is coming in testicular cancer, that means this coal tar factory viper is a essential criteria, is a must present criteria which should be there. Like for example, TB can develop due to multiple reasons, but one thing which should always be there is exposure to TB. There can also be malnutrition which can cause it, smoking can cause it and all, but exposure to TB should always be there. So that one color which is present in everywhere, let's say this graph over here is something which have this dark blue color B component everywhere. In all the curve, whether the percentage contribution of B can be small or big, but B is always there in all the curve. So that means B is that essential or sufficient component which is causing the disease. Does it make sense? Like, let's say I am talking about the reason for my obesity, or reason for obesity in 5 population of different area. So in one reason, the main reason of obesity is the heavy dinner, or let's say diet, improper diet. Other reason can be lack of exercise. Third reason can be obesity can also be due to genetic factors, let's say. But always diet will be there, na? Snacking habit, heavy dinner, all this diet factor will always be there in all the obese people. There will be some component of diet. Of course, there can be this thyroid issue and other issues which can cause it. But if you will observe their diet carefully, you will find in 99% of the cases diet is there. So when you draw this diagram in 5 population, in one population the contribution of diet can be small. In other population number of people who are obese due to diet can be big. In other, it can be 75% people are obese due to their diet only. But diet will always be a factor. Other than diet, there can be multiple factors. Like in one population, the other factor can be, let's say, the lack of exercise is an important factor. And then there are other type of factors which can contribute to it. Let's say drinking is contributing to obesity in some people. Let's say stress is contributing to obesity in other people. Okay, so there can be multiple things, but this green color is everywhere. So this is representing that it is a sufficient cause. Okay, or is it an essential cause which is there? Now, we all know epidemiological triad, and this is agent, host and environment, they interact with each other to produce the illness, so it totally do not represent it. PERT model will have a sequence diagram. Like let's say you are planning for your INI-CET exam in next 10 days. So you should have drawn a proper flow chart of what I will do in this 10 day. And let's say this 10 day you decided that, okay, first of all, I should devote my, at least if I am studying 8 hours, 4 hours in solving PYQ of last 7 year INI-CET. Because if you are perfect on the PYQ topics, then around 50% questions, they are almost from the same topic. There are, like you can see, on an average there are 80% questions which are from the same topic, but 30% they will twist them. 50% will be almost directly from the same topic. So if you are doing PYQ, that topic will be strong and your chance of passing will be higher. And then remaining 4 hours you can devote to your revision of theory and all those things. So in this way, if you will proceed for this 10 day, you will be ready with both the work, and there is greater chance of passing. So this type of diagram is drawn in PERT. PERT, I hope you all know, Program Evaluation Review Technique. It simply means plan your time before taking action. So this is the sequence diagram which we draw in PERT. And web of causation model is given by McMahon and Pug. They gave this web of causation model. They said that disease do not come by one factor. There are multiple factors which create a web and then disease originate. So this is there. Now let's come to this, a frequently asked question in recent exam in NEET, INI-CET both, that let's say they gave you a question where they ask you to find the relationship between aniline dye exposure and bladder cancer in workers who have worked in industry for more than 20 years, and they are creating two groups. One directly involved with dye handling, other are office worker, not directly exposed. And data revealed years of occupation. Which type of study is being performed? So here we are using past work record data. Okay, and based on this past work record data, we are comparing that which group will have more cases of cancer. So can you guess the answer here? Can you guess the answer in this question? Try to reply. See, when we write cohort, cohort can also be written as prospective cohort. Cohort, other name is follow-up study. Other is longitudinal. Other is incidence study, because incidence can be known only in future. And then main thing is exposure to outcome, which we also call as risk factor to disease or cause to effect. So all of these are name of cohort study, and in cohort study when we begin, exposure is present but outcome is absent. Okay, so this is one type of cohort. The second type of cohort, where we only compare past work record data. We do not go in future, we only take past work record data. This type of cohort is known as retrospective cohort. And the other name of it is historical cohort. So in both of these cohort, there will be past work record data which will be given in the question, and there will be no future follow-up. So what is the answer? Very good, Dr. Sakshi, you are correct. Dipender is also saying, Dr. Dipender is saying case control study. Dr. Disrespect and Sakshi and Dr. Bisal Devnath and Dr. Rusty, all these four are saying retrospective cohort. So why it is not case control study? Because in case control study, we take personal history from case and control. But here no personal history is taken. So remember this very important point. In retrospective cohort, we go in past. In case control also we go in past. But here, no personal data taken, no personal history taken. We only compare them based on the work record data. And here, we are not going in the future, we are comparing their past 20-year data, and based on that we are giving the answer. So that's why the answer is retrospective cohort. Okay. Now, let's do one more question on this topic to make it further more clear to you. Come here. This is one more question which came in INI-CET. 30,000 women were examined for 10 years to see if they develop breast cancer or not. 1,200 women were diagnosed with cancer and given a questionnaire to evaluate potential risk factor. Furthermore, 2,000 women from the same study were used as control and were given the questionnaire as well. What is the name of this type of study? So what is happening here? This part they are saying that for 10 years, their data was collected in the hospital. So this is past written record which is there. Okay. Now, then in this past 10-year written record, they found 1,200 women with cancer and they asked them to fill a questionnaire. They also choose 2,000 women from the same study and they also asked them to fill the questionnaire. So that means there are two groups now, one with cancer, one without cancer, and they were given a questionnaire, and then after giving questionnaire, the study was further followed up. Study were being forwarded or followed up in the future. If this study is followed up in the future, in that case, both things will be there, then it will be prospective cohort. Then it will be mixed cohort because we are going in the past and future both. But have they written anything about this part of follow-up or forward study here? They have not written that we are following them in the future. They just said that for 10 years their examination was done, so we had their written data, and now they were asked to fill a questionnaire whether they had cancer or not, what were the exposure in the past. So we already have the past written record data by the examination, and we don't have future follow-up. So because only past written record data is there, and based on that we are asking them to fill the questionnaire, so the answer will again be retrospective cohort. But suppose in this questionnaire, if I ask, in this question if I include this point that after fulfilling the questionnaire, they were followed for next 3 years. If they were followed for 3 years along with past written data, in that case both the work is being done, so we will call it as mixed cohort. The other name of mixed cohort is ambispective because it is going in both direction, past and future both. So it is ambispective cohort. And the third name which we will give it to it is the nested case control. These are the three names in which we go in both direction. And remember this point that whenever in the question you feel that there is a past written record and no future follow-up, then answer will be your retrospective cohort. But if along with past written record, future follow-up is also there, then we call it as mixed cohort or ambidextrous cohort or nested case control. Now, why it is mixed? Because future past both is there. Why it is ambidextrous? Because again future past both is there. Why we call it nested case control? Why it is nested case control? Because out of this two work of collecting past 10-year data and 3-year future follow-up, which one is more difficult to do? Collecting past data is easy. We can collect it just by click of a computer, we can take past record. But 3-year future follow-up is more difficult work. So the main thing is cohort. असली काम है cohort, tough काम है. And in that cohort, data of past is inserted. Cohort में पीछे के डेटा ने घोंसला बना लिया है. That's why we call it nested case control, where the case control is inserted in cohort. That's why we call it nested case control. So these are the three names when the study goes in both direction. And if it is only past written record, then we call it retrospective or historical. So now how will you remember it? To remember it, we can use the mnemonic RH positive man. In R and H, what is R and H? R for retrospective cohort, H for historical cohort. In both of them, only past written record data is used. Only past written record data. And in man, along with past written data, there is one more thing which we take, past written data plus future follow up. What does man stand for? M is for mixed cohort, A is for ambidextrous, N is for nested case control, and we all know for erythroblastosis fetalis, man should be Rh positive. So this is the mnemonic to remember it, Rh positive man. Okay. Now, what are the other options? The other options were case cohort. Usually we do not use this term anywhere. This is just a fulfilling thing. Nested case control will be there if they would have given future follow-up also, but they have not given it. Cross control, again this is something which is just a dummy option. And do remember one point. I said that the first type of cohort is having these names. Cohort is prospective, follow-up study, longitudinal study, incidence study, exposure to outcome. Where exposure is present, outcome is absent. But in retrospective and historical cohort, you can see when we started the study in this aniline industry, already some people had cancer and they were already exposed for last 20 years. So exposure and outcome both are present in retrospective and historical cohort. Similarly, when we will talk about mixed cohort, again already some people have developed disease and the exposure is also present. So both exposure and outcome are present. Remember, only in the first type of cohort study, exposure present, outcome absent. In other two study, retrospective cohort and mixed cohort, both are present. Okay. So do you want me to give one more question to make this concept more clear? Do you want me to give one question for practice? Let's have one question for practice. Okay. Suppose, let's say 500 student admitted in MBBS. And suppose this is your batch who were admitted. Not 500, but suppose there was 500 students admitted in MBBS and blood sample collected from these patients. Collected and stored. They are being stored for future. After 2 years, 3 students developed liver failure. So now all other students are in tension because they were also smoking and drinking the same stuff. So they thought we can also develop liver failure. So a study started which collected the data, which compared blood data of stored 2 years back. They, in this 3 students, they went back and they confirmed it from their blood sample that whether they developed liver failure after coming to medical college or they had liver failure even before coming there. Yeah. So a study started which compared blood data of last stored 2 year back, and I stored 2 year back, and they are comparing it with stored 2 year back, and further 3 year follow up was also done. So which type of study is here? Which study is done here? Try to answer this question. The options are: A, is it prospective cohort? I am waiting for your answers now. B, retrospective cohort. C, nested case control. Or D, case control. So what will be the answer? If you answer this question correctly, it means this concept is now crystal clear to you, because it's not so confusing. We just have to look whether they are only comparing past written record data, then it is retrospective cohort. If they are comparing past written record data with future follow-up, then it is mixed cohort, which is also known as ambispection or nested case control. If they are taking personal history of past, case control. If they are comparing only future follow-up, that is cohort. Okay, prospective cohort. So Pratibha Buddh has answered it first, which is nested case control, she said. And similarly, Dr. Balraj also said nested, and they are both correct. Why? Because here we are using this 2 year back data, and along with 2 year data, we are also doing 3 year follow up. So 2 year back data, 3 year future follow up, it means it is mixed. It means it is ambispection. It means it is nested case control. That's why the mnemonic was MAN. Mixed ambispection nested case control. And our Dr. Sandeep is also right. Rapolo Satish is also right. Very good, dear friends. All of you are right, and I hope this topic is clear to you. Now let's move ahead. Next question is that a patient got a negative test result from a patient point of care, and a sensitivity is 98%. What does this imply? So, what is sensitivity? Sensitivity is very simple thing. It is ability to include. Like in your batch, suppose there is a guy or there is a girl who give their shoulder to all the boys and girls, whoever had a breakup, they are ready with their shoulder. Come and cry here, I will help you out. So that boy or that girl is a sensitive person, because they are including everyone pain in their life. That is sensitive. And let's say if you are a boy and I ask you that will you give your shoulder to both boy and girl to cry, and you said no, I will only make the girl cry here, I will not make the boy cry on my shoulder. So that means you are specific. You are excluding all the boys from your shoulder area. So sensitivity is including, specificity is excluding. If the test is sensitivity 98%, it means it detect it in almost all the people, and it is including all the people which are there. Okay. Now, if you look at the formula of sensitivity, sensitivity is very simple to understand. It is true positive by total disease. But out of the total disease, there is two things. One are true positive, other is false negative. False negative are those which are miss out. Miss out means they have the disease, but they wrongly came negative. बीमारी थी लेकिन पकड़े नहीं गए, मिस होके निकल गए. इसको कहते हैं false negative. अब देखो आप समझो कितना आसान है ये फॉर्मूला याद करना. So easy. You just have to remember that sensitivity is true positive rate. If you remember true positive as the numerator, which you already remember, in the denominator there is again true positive and just opposite of that. What is opposite of true? False. What is opposite of positive? Negative. So if you remember only true positive as the numerator, denominator is true positive and just opposite of that. So true positive plus false negative. Okay, that is sensitivity definition. So sensitivity is 98%, very high. So 98% sensitivity means that the test is including most people miss out or false negative are very less. है ना? Because sensitivity is high, so that means denominator need to be low. We are including maximum people, very few are miss out, very few are false negative. So this is what sensitivity mean. Now let's correlate it with this thing. Very less are missed out. Okay, let's see which of the four statement is correctly telling the same thing. First is the patient would need, if you know the answer you can give it. Dr. Disrespect is giving answer B. Okay. Now the patient would need another, if the sensitivity is 98%, does it mean that patient would need another point of care diagnostic test for same clinical condition? Not necessarily. It's not a diagnostic test. Do remember this point, that sensitivity is most important criteria for a screening test. And for diagnostic test, most important criteria is specificity. Because diagnostic or confirmatory test help us to remove those who wrongly came positive, who are false positive. Specificity is to remove people, to exclude, and we already discussed that. So here, if the sensitivity is high, then it does not tell that we need second test. Second test can be done even after high sensitivity, but it is not telling that thing. Mainly sensitivity, high sensitivity tell us three things. First thing it tells is, which we already discussed, less miss out, less false negative. Second thing which tells out is high false positive. Because if you are including more people, many false positive will also come. Okay. And high sensitivity means it's a very good screening test. And a more than 95% sensitivity means, more than 95% means it's a very good screening test. These are the three things. Okay. Now, here, let's look at the other option which they are talking about. Prevalence of disease is 2%. See, first thing is sensitivity and specificity, they do not depend on prevalence. How many people are suffering from disease, that do not decide sensitivity, specificity. Sensitivity, specificity are intrinsic property of test. They depend on the chemical used, the method taken and all those things. Prevalence is something which is directly related to positive predictive value. If more people are having the disease, then the PPV of the disease will be high. Okay, this again one question, direct question, need previous year also. So PPV decide prevalence. Prevalence has nothing to do with sensitivity. Option C, patient are less likely to have the disease. Okay. If sensitivity are 98%, one thing which I said is that this much high sensitivity also need high false positive. How? Let me explain this with a very simple example. In your NEET, you know what is the current cutoff to get your PG seat? 0 percentile. So 0 percentile when they lowered the cutoff, now every student passed, every student are included in the passing category, more student pass. So if they lower cutoff of NEET exam, on lowering cutoff, sensitivity become high now. Many people, they are qualified now. But the problem with 0 percentile in NEET is that nowadays many students who have not studied well, they will also get PG seat. So they are which type of student? They are false positive. They are those who did not prepared but still pass. So whenever the sensitivity is high, there is high chance that people who will come positive don't have the disease. That's why they write it also in the formula that sensitivity is directly proportional to false positive. If we are including many people like in NEET exam, then many people who will be included or who will pass have not studied. Many people who are included do not have the disease. They wrongly came positive. This is one very important thing. High sensitivity, high false positive. So that means patient who came positive, positive patients are less likely to have the disease. If sensitivity is high, then it means we are including those who are false positive. Like NEET exam, we are including those who did not study. That's why the NEET is passing everyone and the sensitivity is high. Second thing which mean high sensitivity means less false negative, because when the NEET cutoff became 0 percentile, now no one is miss out. No one is away. If you have studied, you will definitely get into the rank of NEET exam. So option D, if you will look, patient has been wrongly ruled out due to false negative. This probability is very less, because when sensitivity is high, false negative you can see in the denominator. So denominator will be low. Only then the sensitivity will be high. So high sensitivity is less false negative. That's why D is also wrong. B is also wrong. A can be correct, but it is not directly indicating that we need a diagnostic test. But still, A and C both are correct, and the better answer will be C. If the sensitivity is high, then many false positive will be there, and there is less likely, patient are less likely to have the disease in spite of coming positive. Okay. But if there is a multiple choice answer, then I can choose A and C both as correct, but better answer will be C. Yes. And if there is any issue or doubt here in this question, you can still ask it again in the doubt group. I hope this is clear to you. Now similarly, just a quick revision of specificity formula, because many a time we remember it and then we forget it again and again before exam. But this is so simple to remember. If you look at specificity, we all know specificity is true negative rate. So true negative is in the numerator, denominator is true negative plus false positive. So again, to remember the formula of specificity, you just have to remember true negative. If you remember true negative, in the denominator there is again true negative, and just opposite of that. What is the opposite of true? False. What is the opposite of negative? Positive. So just remember true negative and then true negative plus opposite of that false positive, and that will be the answer. Okay. Now let's come to this next question. Which of the following causes the widening of confidence interval except? What is confidence interval? This is simply that range of value within which answer lies. Answer is hidden in this range of value. Like let's say I ask it from you, how much marks will you get in your INI-CET exam? And you said, sir, I will get between 60 to 65% marks. I said, how much sure you are that you will get between 60 to 65% marks? You said, sir, I am 95% sure that I will get between 60 to 65% marks. So this 60 to 65% is your 95% confidence interval within which somewhere your mark will lie. And you will get between 60 to 65. So this is a statement of you who is preparing for PG exam, who have done final year and in internship probably or post-intern. But if I ask it from a student who is in the first year, that how much marks will you get in your PG INI-CET exam which you will give after 5 years? And suppose he said, sir, I am 99% sure that I will get between 5% to 95% in INI-CET exam. This much marks I will get. So these are two confidence interval. First is 60 to 65, second is 5 to 95. Which confidence interval is useful विच कॉन्फिडेंस इंटरवल इज सिग्निफिकेंट, किस कॉन्फिडेंस इंटरवल का कुछ फायदा है, कुछ काम है, और कौन सा कॉन्फिडेंस इंटरवल बेकार है. सो यू कैन इजिली से दैट this first year student confidence interval is useless. This is useless because it is not giving us clear idea whether he will pass or fail. But in this final year student, the confidence interval is narrow. So narrow confidence interval is giving us clear idea that he will pass with good rank. So remember this point, that smaller confidence interval range is telling us more significant data. Smaller range, more significant data. Second thing, that here they are saying how can we lower the range of confidence interval. So how this final year student is so sure that he will get between 60 to 65%, because this final year student has solved many PYQ, and he had solved previous year question of INI-CET, and every time he gives some previous year paper, he get between 60 to 70%. So by solving many PYQ, he is sure between 60 to 65% he will get the marks. So what he have done? He have increased his observation. He have increased sample size. If you increase your sample size, if you increase your observation, you will be sure how much you will get in your exam. So if you do PYQ practice paper again and again and you are getting 70%, let's say, then you can say that I will get between 60 to 65. So by increasing sample size, confidence interval range can be narrowed. This is the way of decreasing the range of confidence interval. Let me explain it with one more example. Suppose I ask, how much will you run? How long you can run? And if you ask it from me, I will say I can run between 10 meter to half kilometer. Okay, but if you will ask it from an athlete who is running every day, he can tell you that I can run between 3 to 3.2 kilometer. So why that athlete is precise 3 to 3.2 only? Because he is running every day. He has increased his observation or sample size, and whenever you increase the observation or sample size, your data become precise. So which of the following causes the widening? If you increase sample size, that will not cause the widening, that will reduce widening and reduce confidence interval range. So except for first method, other method can widen confidence interval, but whenever we increase sample size, increasing sample size make confidence interval narrow. Okay, so whenever we increase variation, whenever we increase confidence level, whenever we decrease sample size, this all will make our confidence interval big, and that big confidence interval is not significant. Significant is small, to the point. Okay, so do remember this example. Thank you, Balraj, for appreciating. Now let's move ahead. There is one more question on confidence interval. No, but it is not on confidence interval. This is about central tendency. So let me tell you about one very important question that they ask from confidence interval. Remember, study will be significant if there is two things which is fulfilled. First thing, p value should be less than or equal to 0.05. Second thing is that if 95% confidence interval is in odds ratio or relative risk, then I hope you all know that odds ratio or relative risk less than 1 is showing protective or positive, protective or negative association. And a protective or negative association. Like they have asked this question already in INI in NEET exam, that drinking green tea lowers heart attack, and relative risk for that is 0.85. So which type of association is there? That is protective or negative. More green tea, less heart attack whenever odds ratio is less than 1. If odds ratio or relative risk is equal to 1 means no association. And if odds ratio or relative risk is more than 1 means causative association. Like drinking and accident, more alcohol, more accident. So they are causative or positive association. So remember this point, if 95% confidence interval is in odds ratio and range of 95% confidence interval include 1, if the range include 1, then this data is non-significant. Okay. So confidence interval should not have 1. Why confidence interval should not have 1? Because let's say you are trying to test a new antihypertensive drug, and when you compared it on 100 patient, the result came that new antihypertensive drug lowers BP in range of 95% confidence interval in odds ratio 0.8 to 1.3. So if I have written this thing, this data, is it a significant data or a non-significant data? 0.8 means when you take this new medicine, BP is lowered. 0.8 is indicating protective or negative association. Take drug, BP lower. But 1.3 is showing causative association. That means when you take the medicine, BP increases. So if the same drug is lowering BP and also increasing BP, it means the drug is not related with BP. That is why the same drug is sometime lowering it, sometime increasing it. So if the data has both 0.8 and 1.3, it means negative and positive association. And you can see between 0.8 and 1.3, 1 will come. And 1 odds ratio equal to 1 means no association. So this type of data will be non-significant data. So they ask a lot of questions from it, that which is significant, which is less significant, which is more significant. And I hope you can answer it by these two knowledge. P-value should be less than or equal to 0.05 and range of confidence interval should not include 1. Okay. Now, let me give you some demo questions which can help you in solving such type of problems very easily. Like, suppose they gave you this question where they ask that which of the following study is most significant. Okay. Option A, p-value equal to 0.04, 95% confidence interval is 1.2 to 1.9. B, p-value equal to 0.06, 95% confidence interval 1.2 to 1.3 only. C, p-value is equal to 0.04, 95% confidence interval is 1.2 to 1.6. And D, p-value is 0.04 or 0.03, let's say, and confidence interval is 0.8 to 1.2. So what is your answer? Which study is most significant out of A, B, C, D? Can you give the answer? Try to give it. Valra is enjoying the show. Very good. Keep enjoying it. Can you answer this question? Which is most significant? So first thing is that p-value should be less than 0.05 or equal to that. That's why option B is ruled out. because in B, p-value is more than 0.05, so this become non-significant. Now, A, C, D all are look significant from p-value point. But my dear, if you look at option D, which Dr. Vaisali has said, if you look at D, this D has confidence interval equal to 0.8 to 1.2. So if it is 0.8 to 1.2, it means sometime the drug is lowering the BP, sometime it is increasing the BP, and here range include 1. Range of confidence interval have 1. Because if you see 0.8, then 0.9, then 1 will come, then 1.1, then 1.2. And if range has 1, it means again this data is also non-significant because confidence interval range has 1. So second and fourth is ruled out because of the logic. Now, based on your knowledge till now, out of A and C, which one is most significant study? What is the answer? A is most significant or C is most significant? Okay, so let's see. Both A and C have p-value less than 0.05. So A and C both are significant from the point of view of p-value. But this 1.2 to 1.9 has bigger range of confidence interval, and 1.2 to 1.6 is smaller as compared to 1.2 to 1.9. Between 1.2 to 1.9, 0.7 value come. Here only 0.4 value comes, so it is having a smaller range. And we just read that smaller the range of confidence interval, more significant the data. We want big things in our life, but two things should be smaller. Smaller the better. One is confidence interval, other is coefficient of variance. Both start from C. Confidence interval and coefficient of variance. Smaller range or smaller value, better quality data. Better quality data. Okay. So do remember this point, that these two things should be smaller, the smaller the better. And therefore, which one will be most significant? Yes, Dr. Balraj, you are right. C will be most significant because C have a smaller range. Now, how can you lower the range of confidence interval? To lower the range of confidence interval, increase the sample size. More observation will make confidence interval narrow. So we want narrow confidence interval, that is most significant, and for that sample size should be high. Okay. I hope this part of question is clear. Acha, let me tell you two small point about p-value, because a lot of confusing question comes on p-value in INI-CET exam. First and foremost, p-value simply means probability of getting a significant result by chance or by mistake. Okay, by chance or by mistake. And because it is a by chance or by mistake thing, so we want mistakes should be minimum, and that's why we want p-value to be less. If p-value is less than or equal to 0.05, then it means study is useless, study is non-significant. Sorry, the point is quite clear, I hope, that if p-value is less, it means our mistake is less, our by chance result is less, and whenever you do less mistake, then the result will be significant. So if p-value is less than or equal to 0.05, study is significant, and because study is significant, so null hypothesis is rejected. Okay, this is very simple to understand if you will remember this point, that p-value is same as alpha error. They both have same meaning. They both means false positive. They both stand for false positive. Okay, and a lot of question come from here, so you have to know that alpha error simply means that we are saying non-significant study is said as significant. Non-significant result is said as significant. Let me explain it with an example, interesting example. I still remember my first day of MBBS, 1st of August 2006, and there was a very good girl of our batch, Monica, and it was the first day. So I realized that Monica is looking at me, and I was very happy. I thought that this college is the best college, now my life is set, and I thought her look is significant, and some butterflies started flowing from my stomach and all. But after the class, when I went back and I told it to my room partner Rahul said, "Ki yeah, Monica was not looking at you, she was looking at me." Then we confirmed it with other guy, Neeraj. He said, "You both were idiot. She was looking at me." So what was that look? That look was just by chance. By chance or by mistake, she looked at me and I thought it as significant. I started dreaming something. So it was an error, na? It was a mistake, na? And I took that one look as positive. But I took that look at positive, but it was false positive. It was a false alarm. I became excited unnecessary because it was just a by chance event which I took significant. So that is p-value. And you can see in this example that the look was non-significant, but I took it as significant. So I am saying non-significant and significant, that is alpha error, that is p-value. And now we can understand it with the example of study also. If you know, the coronal study was done on people who were without fever. And then after the study, the researchers and Baba Ramdev and all, they said that coronal can treat corona fever. So if it is done on people who don't have fever, how can it treat fever? So what was done in that coronal study? Coronal drug is non-significant in treating fever, but researchers said that it can treat fever. So they said non-significant as significant, that is alpha error. And they gave false positive report for coronal study. So in that coronal study, they get a significant result that coronal can treat corona fever. But actually that significant result was a mistake, that was an error. So you understand, alpha error, p-value, they both have the same meaning. They means false positive. They means simply whenever you overestimate yourself or whenever you overestimate your study or your result, that is the time when you are doing alpha error or p-value. So alpha error means overestimation. Alpha error means चालू बनना, बेकार चीज को सही कहना, saying useless drug as useful, saying non-significant study as significant, एक तुक्के से हुई look को significant मान लेना, है ना? By chance thing is taken significant, that is p-value, that is alpha error. And both of them should be minimal. Alpha error is type 1 error and beta error is type 2 error. And do remember this point for your exam, that alpha error in one line I can also define it as alpha error means rejecting null hypothesis when null hypothesis is true. Okay, so these all are same thing. Let's say my friend Lakshman, the cameraman, and my friend who is sitting here came to me with his teeth, put it on my stomach and said ki, "Sir, you are pregnant, give me a party now." So what my friend Lakshman is doing? He is getting a significant result by chance. By chance, that was just by bowel moment. He listened to it and he said, "You are pregnant." He gave a false positive report for my pregnancy. Na? He said a non-significant abdomen as significant. So he was doing alpha error. चालू बन रहा था ना पार्टी लेने के लिए, है ना? He was overestimating my obesity as pregnancy. So overestimation, चालू बनना, saying non-significant as significant, p-value, alpha error, they both are roughly the same thing. And in any question on p-value, you just have to think in which of the option the researcher is acting over smartly, the researcher is acting proving non-significant as significant, that will be p-value answer. Now, what does this line means? Rejecting null hypothesis when null hypothesis is true. when Lakshman came to know with this death, actually there is no pregnancy. माँ कसम मैं pregnant नहीं हूँ. There is no pregnancy, so actually null hypothesis is true. My abdomen is null, useless, lull, non-significant. So null hypothesis is true, but Lakshman came and rejected null hypothesis and proved that no, you are pregnant. So that is alpha error, giving false positive, rejecting null hypothesis when null hypothesis is true. If you will remember this part, you will be able to do most of the question on p-value alpha beta error. Just for one last thing which you should know is, whenever we say confidence of is 1 minus alpha error, and whenever we see power of study is 1 minus beta error. Okay, so what is confidence? जैसे मैं सिंपल पूछूं कि आपको आपके दोस्त पे कितना भरोसा है, how much confident you are on your friend. So it all depends कि आपका दोस्त फेंकता कितना है ना. It all depends how much your friend do alpha error. If alpha error is more, confidence will be less. Similarly, how much you trust on yourself. It all depends how much beta error you do. Beta error means underestimation. Alpha error was overestimation. Alpha error चालू बनना, beta error बेवकूफ बनना. So beta error is underestimation. If you are underestimating yourself, your beta error is high, you will say, I am not powerful, sir. I will not pass the exam and all. Why? Because you underestimated yourself, you did beta error. That's why your power was less. So I think this two formula is also useful in exam, you should remember it. Now let's come back to the question, and then we will discuss one more question on chi-square, paired, unpaired t-test, which are very frequently asked. But these concepts are very important when you are going to attempt INI-CET exam. Chalo, now let's come back to the question where we left. The next question was that which of the following statement is not true for descriptions of central tendency? So I hope you all know central tendency is represented by three things: mean, median and mode. Okay, now what is mean? Mean simply means average of all number. And if there is any big number, mean has this problem that mean get deviated towards bigger number. So do remember that mean is most commonly used, but there is one big problem with mean, that mean get deviated towards big number. Okay, bigger number. Second thing is mean or average. These two things, these are the two things which is used for quantitative data. Quantitative data is any data which we can measure. Like I can measure the average weight of the student in the class, average BP, average hemoglobin, average blood sugar. So all this BP, HB, blood sugar, weight, all of these are quantitative data. And in quantitative we are using mean or average. But I hope you all know median is the central number after arranging number. Central number after arranging. And because it is central number, so even if it is a big number at the end, median is not affected by it. So do remember this point. They confuse you in different question with this point. Median is not affected by bigger number. Okay. Now, what is mode? Mode is most commonly repeated number. Most commonly repeated number. So let's say there is 2, 2, 4, 6, 9. What is the mode? 2 will be the mode. What is the median? 4 is the middle number, so 4 will be the median. But 2 is the mode, but is 2 coming in the center? Is 2 in the center? No, na. 2 can go anywhere. So mode can go anywhere. That's why we very rarely use mode. We don't use mode commonly. So least use is mode, most use is mean. But both this median and median and mode, do remember, median mode both are used for qualitative data. Whenever we talk about qualitative data, we also have to remember qualitative means which can be divided in category. Like let's say you talk about my obesity. Can you tell that, sir, you are 3.2 obese? No. You can only say that, sir, you are mild obese, moderate obese, or severe obese. You can only categorize obesity. You can measure weight. So weight is quantitative, but obesity, hypertension, anemia, all of these are only categorized. So these are only categorical. So do remember, qualitative data is same as categorical data. And for these, we use median and mode. For qualitative data like number of hypertension people, diabetic people, number of anemic people in the group, mild, moderate, severe anemia and all, these all are qualitative data. And whenever we measure hypertensive, diabetic or anemic people in the group, we say that 30% are anemic, 40% are diabetic, 50 out of 100 are having obesity. So qualitative data is represented in percentage or proportion. Median and mode explain it, but it is measured in percentage or proportion. I will use this information to teach you when to apply chi-square, paired, unpaired and t-test also just after this question. So this is very important concept to keep in your mind. Now let's read the option one by one. Option A, and if you can answer, please answer it. Balraj has given a very good thing that if you want to get a seat in INI-CET, then your p-value must be on the lower side. That means in the exam, you should not tick question as false positive. If you tick more false positive, like 5% you tick thinking they are positive but they are wrong. That is false positive alpha error. So more alpha error, more false positive, more p-value, less chance of selection. That's why Dr. Balraj is very right in saying less p-value, less alpha error, more chance of getting INI-CET rank. Very good. And some friends are asking when the PSM class will be there. First thing is, this topic and discussions are also related with FMG exams. Second, there will be one more separate session for FMG exam also, my dear friends. It will be there for sure, a big session. But do read these topics, because if they make the paper tough, then this type of question can also come. Plus, this has came in recent 2-3 question which I have discussed here is also from FMG exam which came. So the level of FMG is also very high these days. So do read the questions here, options here, and try to answer this question. Please guess the answer if you can. That which of the following is not true for description of central tendency? First, mode is affected by extreme value. No dear. Mean is affected by extreme value. Of option B, mean is affected by extreme value. This is correct. Mean is affected by extreme value. Median is calculated by overall observation. Very good. Whenever we write all the observation, then we find the middle number, that is median. So this is also correct. Mode can be used for qualitative data. Yes, they are right. Mean is for quantitative, mode and median are for qualitative. So all B, C, D are correct. They are asking which is not true. So not true is option A. That's why the correct answer will be option A. This is the correct answer. Okay. Now, a similar question on this pattern came in FMG exam. Let's see that also. No, this is not the question. Yes, this is the question. What will be affected in an experiment in which 39 was the highest value but was mistaken for 93? Let's say I am measuring the kamar, waist of 5 of the people, and I have written it as 35, 36, 37, 38, but in place of 39 I write 93. Okay, so in an experiment I should have written 39, but in place of 39 I write 93. Okay, so then which is correct in the 4 options? Please try to give answer. First option, mean will remain same, median will increase. Second, mean and median both will increase. Third, mean will increase, median will be same. Fourth, both mean and median will decrease. What is the correct answer? Do remember one thing, that whenever we change the last number, median remain unaffected. So median will remain same will be the definite correct answer. Because here it is 37, in 93 also median is 37. And if you make it this digit 35, 36, 37, 38 and 39, again the median is same 37, but the mean is affected. In this distribution, if you find the mean will be 37. Without calculation I can tell it, because it is a symmetrical distribution, every number is equally away. And if it is a symmetrical distribution, middle number become mean. So mean is 37 here in this data, and median is also 37. But if you try to find out the mean of this distribution, then to find the mean of this distribution you have to add all the number, this is sign of summation, and divide it by sample size. Sample size is 5, let's add all the number, 1, 2, 3, 4, 4, 3, so 120 plus 90, so it will be 210. Now let's add all the number, 5 plus 6, 11, 11 plus 7, 18, 11 plus 7, 18, yes, 18 and 8, 26, 26 and 3, 29. So 210 plus 29. So it will be around 239. So 239 by 5 if you will do, it will come roughly around 50 and 48, let's say. So 48 you can see is close to 93. 48 is the new mean. So you can see here that mean increased from 37 to 48, but median remains same. So this will be the thing. If I am changing a small number with big, then mean will increase. And if I am changing big number with a small, mean will decrease. But median will always remain same. So if there is any large distribution, that's why Dr. Balraj has answered it C, very good. Let's say if they gave this question that systolic BP was measured and it came 120, 124, 126, 128 and 188. So which is the best to measure central tendency in this type of data? So if there is last big number, then it is not good to use mean, because mean is mean minded. जहाँ बड़ा number देखता है ना, mean फिसल जाता है. Mean get deviated towards big number. So in this case, which is the best to use? Median is better to use. Okay, mean is not better if there is a big number. In those cases, median is better. Okay, so I hope this two part is clear to you. Now, let's see this question. We have discussed in the previous question that whenever the data is in percentage proportion, it is qualitative data. And do remember, they ask a lot of question on chi-square, paired, unpaired and ANOVA test. So do remember this concept that if we are comparing qualitative data, this is a simple way to decide which test to apply. If qualitative data or categorical data compared between two or more group, which test we will apply? We will apply chi-square test. Okay, this is known as chi-square test. And if data is quantitative, do remember qualitative data is in mode median, qualitative data is in percentage or proportion. So if they write in the question percentage, proportion word, median or mode, answer will be directly chi-square test. But if the data is in mean, average, if data is quantitative, then we have to see whether they have used the word pre, post, before, after or matched in the question or not. If these words are given in the question, match data, pre, post data, before, after data, in all these cases, we will apply paired t-test, which is also known as dependent t-test. If the data is of two group quantitative, we apply student t-test, which is also known as unpaired t-test or independent t-test. Okay, And if the data is of 3 or more group, we apply ANOVA. And ANOVA is known as analysis of variance. So, in most of the question on chi-square, pair t-test, unpaired t-test, we can solve it by using this concept only. Let me give you a practical example and then let me see whether you are able to apply the concept there or not. Suppose they give this question, effect of exercise on percentage of obese student among second, third and final year can be compared by which of the following test? And to help you there, which of the following test can compare this thing, effect of exercise on percentage of obese student among second, third and final year? Option A, will it be pair t-test? Option B, will it be unpaired t-test? Option C, will it be chi-square test? Option D, will it be ANOVA? What is your answer? What will you do here? Which test will you apply here? First thing is, because in the question obesity was not measured before and after, or weight was not measured before after, pre post match word are not given, so pair t-test cannot be the answer. Second thing, how many groups are there? Please try to give answer and just guess it. Vikas Raj is saying that chi-square will be there. Okay, let's see. So one thing is sure that there are 3 groups and unpaired will be the answer only if there is 2 group. So unpaired is also ruled out. Now answer is between chi-square and ANOVA, and Vishal Devnath is also saying C, and both Vishal and Vikas are right. It is chi-square. Why? Because the data is obesity. Obesity cannot be measured. It can only be categorized into mild, moderate, severe. And the data is in percentage also. So percentage, obesity, both are indicating qualitative data. For qualitative data, we use chi-square test. If in place of obesity, they said weight was measured, weight of second, third, final year is measured, weight is compared. So weight is quantitative, answer will be ANOVA. If they say weight of second and final year compared, then answer will be unpaired because weight is quantitative and there are 2 groups. If they said that weight is compared, before and after exercise. So before and after exercise and weight is a quantitative data, answer will be pair t-test. So like this, I hope this concept is clear and you can apply these concepts and answer those questions. Yes, Balraj and Dr. Neha and Dr. Varun Kashyap, all of them were right and all of them gave C answer. Very good, my dear friends. So this concept is clear to all of you. Now let's come to the next concept. In Japan, the average life expectancy for a woman is 87 years. There is an increase in life expectancy by 15 years due to recent advances in testing for cervical cancer. The healthcare utility value is 0.8. Which of the following can be calculated from parameter given below? So, do remember, what is this HEL? HEL simply means healthy life expectancy. Actually, if you look at the full form, it is health adjusted life expectancy. But to understand it better, you have to adjust the adjusted word, remove it. So it will become healthy life expectancy. Healthy life expectancy estimated at birth. This is HEL. And they are giving the average life expectancy 87. But this is HEL is something which is different in urban area, rural area, differ from country to country, and the main data which they have given in the question is regarding this increased life expectancy by 15 years. What does this data will help us to calculate, they are asking. So let's move ahead and let's see what are the other factor. DALY being asked again and again, it is the best morbidity indicator. DALY is best indicator of burden of disease, best morbidity indicator. And in the DALY part, which is stand for disease adjusted life year, there is two things. One is year of life lost due to early death, and other part is years of life lived with disability. Okay, so if you add these two components, then you will get DALY. For example, let's say an Indian died at 50 years and last 5 years he was on dialysis. Okay, so can you find DALY for this person? The expected life expectancy in India is 68 years and he died at 50. So 68 minus 15, 18 year will be the year of life lost due to early death. Plus how many years he lived with dialysis? 5 years. So 18 plus 5, if you will add, 23 year will be the DALY in this case. Do remember these two components. Now the third thing they can ask you is Sullivan index. Sullivan index simply means, this is a good question to revise all this morbidity indicator which are confusing. So let's revise it properly before exam. Sullivan index simply means how many years you are living, years of life lived without disability. How many years you are living without any problem, lived without disability, without any issue. Okay, so if they are asking years of life without disability, then in this story, how will you calculate Sullivan index? That will be equal to, this formula is Sullivan index is life expectancy minus DALY. So life expectancy for Indian is 68 years and in this story the DALY was 23. So if you subtract 23 from 68, it will come 45 years. And you can see it in this story also that till 45 years, this man has no problem. So how many life he lived without disability, without any problem? 45 years. So do remember the formula, life expectancy minus DALY. But in this question, DALY is not given, so Sullivan index can also be not calculated. And DFLE is nothing, it is just a confusing option being kept. So let's learn what is QALY. QALY stand for quality life year. But it simply means that quality life year added due to an intervention. Added due to an intervention. For example, in Park textbook they have written that dialysis add 0.5 QALY in life of patient each year. So let's say you want to get fund to help the renal disease patient in your state and there are 10,000 patients on in need of dialysis. So you can go to your chief minister and you can say, hey Mr. Chief Minister, open a dialysis center. There are 10,000 people in need of dialysis. So 10,000 into 0.5, we will be able to gift them with 5,000 quality life year. So they will vote for you, their relative will vote for you, and therefore they might give fund to you to open the dialysis center. So do remember this point, that whenever some intervention is adding in the quality of life, that is QALY. And here in this example in Japan, the same thing was happening. What was happening? There is increase in expectancy by 15 years. So people are living 15 years more. Their quality of life is better. Why? Because they are now screening cervical cancer early and diagnosing it. So this 15-year life expectancy has increased. Quality of life is better. That is a data which quali is giving. So quali, if there is a positive news by any new thing, people life is getting better, that is quali. And if people are suffering more, then the best indicator will be DALI. Okay, so do remember these 4 indicator. HEL is healthy adjusted life expectancy at birth. Quali is quality of life added due to intervention. DALI is life lost plus lived with disability. And Sullivan index is life expectancy minus DALI. Okay, do revise it all. Now, let's see the next question. This following formula correspond to. See, if you see the under root thing, that is standard error. If you see only this much part is the formula for variance. Because I hope you all know standard deviation is under root of variance. Okay. Mean is average. So mean or average or mean can be written by this formula, that's adding all the number dividing by sample size. And this is x1 plus x2 till xn, we will add all the number, divide by sample size. This will be the formula for mean if you have any formula. And median don't have any formula, it is simply the middle number. So do remember the formula. In the formula there is under root, square is also there, and the denominator is n minus 1 till sample size is less than 30. If sample size is more than 30, then standard deviation will become under root mean minus number. And this is mean minus number. Sometimes they write number as mu also, like that, mean minus number by n. And of course we will have the square thing here and adding all the number here. So if the sample size is less than 30, we do n minus 1. If the sample size is more than 30, then we need not to subtract 1. What is this n minus 1? This n minus 1 is known as degree of freedom. Like, suppose I have 5 finger. Suppose I have 5 finger. Na? So out of 5 finger, how much finger I can choose? I can choose the 1, the 2, the 3, the 4th. But when it comes to the last finger, there is no option to choose. So my degree of freedom of selection is 4 out of 5. I can choose only 4 finger out of 5. That's why we subtract 1 from the sample size. But subtracting 1 matter till 30 only. After 30, if you remove 1, that does not matter. So we are subtracting 1 only till 30. After 30, it does not matter. Okay. Why I was laughing when I said I suppose I have 5 finger, because usually we think that we all have 5 finger, but not everyone. Like my younger daughter Prisha, she had in one hand both these 2 finger joined together. So she only had 4 finger. And if Prisha will say fuck off to the world in her future life, she will say it like this. So anyway, do remember this formula, and let's revise this concept in a nutshell so that you do not forget and confuse in this formula. How do we measure spread of data? This is measure of dispersion or spread of data. How much is the data spread? It can be measured by 5 things: range, then there is variance, then there is a standard deviation, standard error, and sometimes people also use one more thing, mean deviation. So 5 things tell about dispersion, spread of data. And we always want a data which is to the point. Like, which type of curd would you like? The one spread on the table or one in the katori? Of course, you would like the one which is in the katori, which is to the point. Otherwise, how will you eat the curd? Very difficult to eat now. So we want data or curd to the point, and I like that, because to the point explains some result better. Now what is range? Range simply means upper limit minus lower limit. That is range. Suppose I am planning to give you a party after the class, and I ask how much will you drink? And the upper limit student said I can drink up to 4 liter. Lower limit they said 100 ml. And so I have to arrange the drink, but if I arrange 4 liter for all of you, there will be lot of wastage of drink. If I arrange 100 ml for all of you, you will beat me badly. कि मोटे औकात नहीं थी तो बुलाया क्यों? When you don't have money, why you ask us for party? So I cannot get any idea how much you will drink based on this data. So what I can do is, I can take random sample of 3 students from the class and I can ask from them how much they will drink. So suppose one person said I will drink 1 liter, second person said 2 liter, third person said 3 liter. So in this data, 1 liter, 2 liter, 3 liter, standard deviation simply means how far is all the number from the middle number or mean. And in 1, 2, 3, 2 will be the mean. Because again it's a symmetrical distribution, every number is equally away, so middle number become mean. And you can add it also, 3 plus 2 plus 1 will be 6, 6 by 3 will come 2. So 2 is the mean. And how far is each number from 2? 3 liter is 1 liter away and 1 liter is also 1 liter away. So standard deviation is 1 liter because standard deviation tell us how far is each number from the mean. So each number is just 1 liter away. So that's why standard deviation is 1 liter. And similarly, mean deviation is also same as a standard deviation, almost same. Formula is different, but they are the same. It will also be 1 liter. Now, what is variance? Suppose you want to calculate variance in this data. So to know the variance in this data, what we have to do is, we have to subtract the number from the mean. Mean is written as x bar. Number is written as x or mu. And then we will add all the number divided by sample size minus 1. So sample size minus 1 means n minus 1, because n minus 1 is the degree of freedom, we have already read. So if you subtract mean, which is 2 liter from 1 liter, and then if you add by subtracting 2 liter from 3 liter and divided by 3, total student were 3 dividing by minus 1, how much you will get? 2 minus 1 will be 1, 2 minus 3 will be minus 1 by 2. So it will come 0 by 2 or 0. That means how much drink I should arrange for the party? 0 drink. Is it a correct variance? Of course not. That's a wrong data, wrong variance. Why this wrong variance came? Because the minus and plus sign were cancelling each other. So if you want to get a correct variance, you have to remove the minus sign. Now how can you remove the minus sign? To remove the minus sign, there are 2 ways. We used to read in math in board mass. One thing is some bracket come and they make the minus invisible. And so that bracket come in mean deviation. So what is mean deviation? Mean deviation is same as variance formula here, but we write mean, that is x bar minus number, and we put that magical bracket here and n minus 1, that is mean deviation. But we cannot put that bracket so easily and remove minus sign. So what is the other way of removing minus sign? Minus sign can be removed by multiplying minus with minus. So if you do square will remove the minus sign. So in variance, we don't just do mean minus number, we do square of them to remove minus sign. And if you do square, it will be 1 square plus 1 square, 1 plus 1, 2. And 2 by 2 will come 1. And so the variance was 1. Now, we did a square, but actually we don't want it to do the square. We just want to know how far is each number from the mean. So we were not willing to do square, we have to do it forcefully. So now we have to remove the square. How can you remove the square? To remove the square, you have to do under root. That's why we do standard deviation is under root of variance, and it is under root of mean minus number whole square by n minus 1. So you realize how the formula came. Formula came by 3 steps. First step, we subtract mean minus number divided by sample size minus 1, that is degree of freedom. Second step, to remove minus sign, we did square. Third step, to remove square, we did under root. So that's how this formula came. If you remember the 3 steps, you will never be confused in the formulas if they will ask in the exam again. And they have already asked the formula 2 times in INI-CET, so it is more expected here. Now standard error is standard deviation by under root of sample size, and there is one more formula, under root PQ by N, where P is the prevalence, Q is 100 minus prevalence, and N is the sample size. So these 5 things measure dispersion, and I hope you will remember and identify their formula. Chalo, now let's come to the next question. Which of the following may not be used to find the normality of data. So usually if you see, the normality of data, like let's say I have this type of histogram, this type of histogram I have, suppose, and in this histogram if you draw a curve, it will go like this. So what I have drawn here, these are the histogram, or you can call it as, and when I plotted a curve over here, it became a plot histogram. So plot histogram can help us in knowing about central data. So plot histogram tell about normality of data, because normal data is the one in which 50% are on this side, 50% are on this side. So normality of data, plot histogram can tell. Then we all know about this box and whisker plot, I hope you know. In box and whisker plot, this part is 25% first quartile, this part is 75% third quartile, and the middle line is usually the median. But if the middle line is in the center, it means it's a normal curve, because then 50% will be here, 50% will be here. So box and whisker plot help us to identify outlier. These are outlier. Outlier means extreme value. Like in UK population, they do a survey every 3-4 years that how many sexual partners you have in your life. Usual answer come 2 to 7, but some people answer like 498 sexual partner, 699 sexual partner, 738 sexual partner. So if you include those hunters data in the data of normal population, then the average of UK will become very high. So should we include those hunters data of 699 and all, or should we remove them? We should remove them as outlier. So that is done by drawing box and whisker plot. It helps us to identify what are extreme value and remove it. So box and whisker plot can also tell normal data. If the middle line is in the center, it is normal data. Now, so this is also correct. What is Shapiro-Wilk test? See, I have drawn this green plot here, and I am saying this is a normal curve. But if I draw the curve something like, let's say this, is this a normal curve also? Very difficult to know whether it is exactly normal, which one is exactly normal, which one is deviated from it. So whenever we want to compare two curves and we want to know whether our curve are significantly different from normal or not, we use Shapiro-Wilk test. Shapiro-Wilk test is used to compare normalcy of data. Normalcy of data. How we compare normalcy of data? If the p-value is coming more than or equal to 0.05, it means data is non-significant because you have done too much of error, and non-significant data is removed. But if the p-value came less than here p-value should always be more than, it's very good that we do this mistake. Do remember, non-significant is only if it is more than 0.05. If it is equal to 0.05, even then we call it as significant. So Shapiro-Wilk test compare normalcy of data also. Only one thing which do not compare normalcy is Mantel-Haenszel test. Mantel-Haenszel test is compare the significance of two paired or matched data. Compare matched data or categorical data. And matched data means before recruitment you are matching the people and then doing a study on that. So compare matched data of two or more group. For example, let's say you want to know whether smoking causes cough or not, and in both the group you have taken people between 20 to 25 year in smoker also, and in non-smoker also you have taken 20 to 25 year people. So this type of data are matched because before recruiting they were having the similar age group, and you are matching them and then putting them in the study. So when we are comparing the match data of two or more group, then we use mental Hengel test. It is similar to McNemar test, but there are some difference there. So mental Hengel is not used for normalcy. Plot, histogram, box whisker, Shapiro-Wilk, they are used for normalcy. Now let me tell you one more thing which they ask sometime here. They give you a box and whisker plot with bar, let's say above, or they can give you a box and whisker plot with bar below, and this is A and B. So out of A and B, which one is positive skewed curve? If you know, please give answer. Which one is positive skewed curve out of A and B? So to know that skewed curve, we all know 25 and 75% are the two things, and of course 25 will be lower, 75 is above. So if you look at plot B and try to draw an imaginary line here, it will go like this. This part is the skewed part because skewed means stretch, and we can see here that skewed part is between bigger number 25 to 40 to 75, and whenever you are moving towards bigger number in your life, you are positively skewed now. So this type of curve will be positively skewed curve. Okay, so there was one student, I was taking this class in Jaipur, who told me a very good idea to remember it forever. He said that, sir, imagine this bar as penis or thought of sex, and whenever the penis or thought of sex is in our head above, that is the time when we don't concentrate on study and our marks goes negative. So if the penis or thought of sex is above, it is negative skewed curve. And he said if the penis or thought of sex is below the belt, under our control here, then we can focus on study, our mark is more, so that is positive skewed curve. I said very good, and a good way to remember it. Negative skewed bar above, positive skewed bar below. The same formula can be used to remember the formula of positive and negative likelihood ratio. What is the formula of positive likelihood ratio? In positive likelihood ratio, we write it as 1 minus sensitivity by specificity. This is formula of positive likelihood ratio. No. What is the formula of positive likelihood ratio? Positive likelihood ratio is sensitivity by specificity. But positive means bar should be below. So it is 1 minus specificity. Bar is below. Minus sign is lower side. Under our control. What is the formula of negative likelihood ratio? Again it is sensitivity by specificity, but this time the bar or the thought of sex or the penis is in the head, so that's why it is negative, so 1 minus will be above. So in negative likelihood, 1 minus will be here. In positive likelihood, 1 minus will be below. Okay. So again the same concept can be used to remember that also. Yes, Bisal Devnath is very right in telling that plot B is positive skewed, A is negative skewed. Thank you, Dr. Devnath. Now, let's move ahead to the next question. Which organization provides seed and manure in applied nutrition program? This is a repeat question. I think you know UNICEF provided, and UNICEF also work for maternal and child health. But these days they are asking a lot of questions from funding. Like in the recent exam, they asked which organization funds sanitization work? Sanitary latrine, which fund? So sanitary latrine fund come from FORD. ऐसा याद रखना, FORD के हगा है ना ये, FORD for this sanitary latrine and all. And after latrine, of course, you will take bath. So NIHAI, National Institute of Health Administration, that is also funded by FORD. Second question they can ask is from the CARE Foundation. What does CARE Foundation fund for? It care for the children nutrition. So CARE Foundation fund ICDS and Anganwadi program. Then they can ask what does Rockefeller fund for? So we have a Rockefeller's rock solid foundation if we are doing research. So Rockefeller Fund Research and National Institute of Virology at Pune. Similarly, last time they have asked in NEET exam that who fund cobalt therapy unit. So either it's cobalt therapy unit or it's AIIMS New Delhi, both were being funded by Colombo Plan. Colombo Plan also fund industrial and agricultural research, but main are these. And then they can be asked about Red Cross. Red Cross is the one which fund disaster and war victim relief. Disaster and war victim relief. This is the work of Red Cross. I don't know they are doing this work in Gaza or not these days, but that is the work allotted to them. And do remember, if they give you this image, this is not of Red Cross. This image is of Suraksha Clinic. Red Cross will be completely red like this. This is Red Cross. This is Suraksha Clinic, which is for STD patients. It is example of public-private partnership, just like the mobile health unit. But remember, in both mobile health unit and Suraksha Clinic, medicine is always given by government. Ambulance, doctor, building, they can be government or private, but medicine in both mobile medical unit and Suraksha Clinic are from government. Okay. Then they can ask you some more funding, like who fund malaria program. It's quite strange, so remember it carefully. Malaria program is funded by US aid. So it's aid, but it is not funding AIDS program, it is funding malaria program. Who fund TB program? Answer is SIDA. Who fund eye program? Answer is Danida. How will you remember it? Netradan, eye donation. Dan is of eye. And S for SIDA, S for sputum. So TB program, SIDA. Who fund family planning program? Family planning program is funded by UNFPA, United Nations Fund for Population Activity. And who fund Sustainable Development Goal? Sustainable Development Goal is funded by United Nations Development Program, UNDP fund Sustainable Development Goal. Okay, so there are some funding organizations which we should revise before exam. Coming to the next question. This next question is based on Kappa statistics, which I don't think can be solved without pen. What is Kappa statistics? Kappa statistics help us to know inter-observer agreement. Let's say Dr. A saw an X-ray, 10 X-ray he saw, and out of 10 X-ray he said that TB is there in 8 X-ray and there is no TB in 2 X-ray. And when Dr. B saw the X-ray, he said that TB is there in 6 X-ray and there is no TB in 4 X-ray. So whether these two researchers agree a lot or their agreement is not there, that we can decide by Kappa statistics. It is telling us inter-observer agreement. The formula for Kappa statistics is, it is the observed agreement, agreement which is observed in this study, minus agreement which is expected, expected agreement, divided by total agreement minus expected agreement. So this is the formula for Kappa statistics, and this type of question can be easily done if you understand this point, that in all the numerical, if they give you the numerical, expected agreement will always be around 0.5, 50% or 0.5. In this example also it is 0.5 or 50%. So expected agreement is 0.5 or 50%. And of course total agreement will be 1. 1 will be the total agreement. If you add all the things, it will be 1. Now, agreement which is observed, this agreement which is observed can be detected by multiplying A and D, because I hope you know in a 2 by 2 table A is true positive, D is true negative. So in this 2 point 80 and 60, both researchers are agreeing. The Montux is also detecting 80 positive, IGRA is also detecting 80 positive. So they both agree here at 80. Similarly at negative also they both agree that 60 are negative in Montux, 60 are negative in IGRA also. So if they are asking agreement observed, that is A plus D divided by total, that is A plus B plus C plus D, that will give us the agreement which is observed. Now how much is the agreement which is observed? 80 plus 60, that is 140, divided by A plus B plus C plus D. How much is the total thing? 80 plus 20 is 100, you can see. 40 plus 60 is also 100. So 80 plus 60 by 200. So it is 140 by 200, or you can say it is, if you cut it by 20, it is 20 will cut it by 7 by 10, or it is 0.7. So this is the agreement which is observed, and if you apply it in the formula, the kappa will come 0.7 minus 0.5 divided by 1 minus 0.5. So it will come 0.3 by 0.5 or 3 by 5. So 3 by 5 can be written as 0.6. Why 3 by 30 by 50 if you will write 3 by 5 or 30 by 50? 30 by 50 simply means that if you subtract it divided by 5, 30 will be cut by 6 and 50 will cut by 10. So 6 by 10 means 0.6. Anyway, 3 by 5 is 60%. So answer will be 0.6. So this is an easy way of doing it. But we can also do it in complex way by calculating the expected agreement and then subtracting it from the observed agreement and then doing the answer. But because they are not giving you pen, they will never give a calculation on this type in any of the exam. And you just have to remember that kappa statistics is telling us inter-observer agreement, and the formula for this is agreement observed minus expected by total minus expected. Expected are usually 0.5, agreement observed you just have to find, and total agreement is usually 1. So by applying it in the formula you can get the answers. But of course it cannot be done without pen. Now this is one type of question which they are asking nowadays. They will give you a real plot and they will ask which type of epidemic is this. So to identify the type of epidemic, one thing you have to know is which illness they are talking about usually. So here in this question they have not given you the illness, but usually they give you the illness. Let's say this is a illness which is showing you, but they have not given the illness, which illness is here, so it will be difficult. But how we decide this type of thing is, we have to see whether the cases which are occurring, if the cases are occurring within one incubation period. That's why they should have told you the disease which is there. So if cases are occurring within one incubation period, then we call it as point source, or other name is single exposure, common source single exposure. These are the two names, point source or common source single exposure epidemic. These two will be given the name if it is within one incubation period. So all the outbreak which occur within one incubation period will have a quick rise, quick fall, and cases, the time which is taken is less than one incubation period. The example of single exposure epidemic can be the food poisoning occurring in the hostel area or Bhopal gas tragedy and all. Now, second type of epidemic is common source continuous exposure. In this, the main difference is cases occur in much more than one incubation period. So the time they take is more than one incubation period. So for answering such question, you should know incubation period of some few things which they ask in form of epidemic. One is cholera. For cholera, the incubation period is 10 to 50 day. Other is the hepatitis A. For hepatitis A, no, sorry. For hepatitis A, the incubation period is 10 to 50 day. For cholera, the incubation period is maximum up to 5 day. So it is 1 to 5 days. Really sorry for that mistake. 1 to 5 day is for cholera. 10 to 50 is for hepatitis A. I was writing hepatitis A earlier. For syphilis, it is around 90 day. Okay. For chicken pox, it is 14 to 16 is the average. But if you write maximum, it is 14 to 21 day. So the point is that in this graph which they have given, they are writing that October, November, December, January, in all of these the cases are occurring. And the cases which are occurring, it is taking more than 3-4 months to occur. So if it is cholera or hepatitis A, hepatitis A can only be point source if cases are occurring within 5 days in case of cholera or within 15 days hepatitis A. So because the cases are taking more than 3-4 months, it is very less likely that it will be common point source single exposure epidemic. And what is the difference between common source continuous and propagated? In propagated epidemic, main thing is that there will be secondary wave of cases. There will be secondary wave of cases. Only then we will be able to tell whether it is propagated or not. So if you are looking at the graph suggesting of propagated epidemic will look something like this. First one wave of cases came, rise slowly, plateau, and then fall slowly, and then second wave of cases occurred. So this is for propagated. Example of propagated, I hope you know from the secondary wave, this must have came in your mind that propagated epidemic example is one which we recently faced COVID-19, because COVID-19 has this secondary wave also. Then the second what I was telling you is common source continuous exposure, which is very commonly asked. Common source continuous exposure have 5 example under it. One example is the very famous typhoid Mary, who was a chronic carrier of typhoid bacilli. Second is sex worker transmitting gonorrhea. Third is milkman distributing contaminated milk in the villager. Fourth can be contaminated batch of polio vaccine. And fifth example is, what are the 4? Typhoid Mary, sex worker distributing gonorrhea, contaminated batch of polio vaccine, milkman distributing contaminated milk. And fifth example is Legionnaires disease outbreak which occur in America. So all of these are example of common source continuous exposure, because one common source was there and then cases keep on occurring. I am searching for a good image of this type of epidemic which is there in my this thing. I will show you the good image to identify the propagated epidemics and all. We can see it very well through, understand it through images and all. But let me search just 1 minute. Sorry for this inconvenience. Yes, it is here. So they can ask you an image based question from here telling you that what is it suggesting and all. Okay, so let's say they give you this image. Yeah, this image. Now you can see it. In this image, they are telling you that there is hepatitis A. And if you can, this is hepatitis A. They have written as the illness hepatitis A. And the cases are starting with 25th of April going till 25th of May. So, for hepatitis A, the incubation period is 50 days. and cases are occurring from 25th April to 25th May. So within 30 days, all cases are occurring, and you can see the cases are rising quickly, falling quickly. So this type of image will be for point source epidemic, which is written here also. This is point source, and other name of point source is common source single exposure. Now, if they gave you this type of question below, this is cholera onset, and cases are occurring from 31st, the first case is around 19th August, but you can see 31st August till 27th of September. So cases are taking more than 5 days. For cholera, incubation period is 5 days, cases are more than 5 days, and there is only one wave, not secondary wave. So this is common source continuous exposure, which is written here, common source continuous exposure. Okay. Now, one more type of image that they can give you is this propagated epidemic image. And in the propagated epidemic, the image will be like this. Can you see it? Yes. First there is one wave, and after one wave there is secondary wave of cases which is bigger. And they are talking about, again they are talking about some epidemic. The epidemic is for measles. Measles incubation period is 10 to 14 days, and cases are occurring from April to May. So it is taking much more than one incubation period. So I hope this three thing is clear. Secondary wave, larger wave, that is larger than the first wave. If you can see secondary wave larger than the first, that is propagated. And if you saw only one case but cases taking more than one incubation period, is common source continuous exposure. And if you say cases occurring within incubation period, that is single source or common point source epidemic or common source single exposure epidemic. So these three type of plots are there which they can ask you directly. Let's come back to our question and see which plot was there in our example. So if you see our example, in our example, first there was one wave, and after one wave, this is the first wave, after first, second and third wave were also there, and they were very higher from the first wave. So it can be more likely of a propagated epidemic. Okay, it is suggestive of propagated. If second, third waves are there and they are bigger than the first wave, it is secondary wave, and that is propagated epidemic. Okay, so we can answer like that. Which of the following is not included in step approach? This step approach or step surveillance is done to know the high risk population for NCD. Like if suppose they ask in which country there are more high risk people for diabetes, whether it's India or China. So if you want to know it, what you have to do is you have to take 5,000 population randomly, you have to choose from different country, and then you will ask them three types of question. First question you will ask from them is about psychological factor, and we all know psychological is also known as behavioral factor. So what all behavioral factor can cause diabetes and hypertension? Of course, diet can cause it, where exercise can cause it, then smoking, alcohol can cause it. So first, and in Delhi, I just visited one urban health center, and I came to know ASA is doing this surveillance right now in some part of Delhi also. So they are taking smoking, alcohol history, psychological factor. This is first step. Second step are physical factor. What are the physical factor that can be taken? One physical factor can be BP, second can be body mass index, third can be age. And then there is the hormonal factor. Hormonal factor is also known as the biological factor. And the hormonal or biological factor which they calculate in India is only one random blood sugar. They have asked it in INI-CET exam that at sub-center do we measure random or fasting? We measure only random at sub-center. And best time to measure random blood sugar in pregnancy is 28-week gestation. But we measure it between 24 to 28 week. Okay. So in India, we only measure random blood sugar, but in other country, we also measure lipid profile, like in developed country, UK, USA, we can measure lipid profile and thyroid profile as well. So they have asked two questions from this part, very high. One thing is which is not included in this. So 5 tests are included in it. What are the 5 tests? BP, sugar, lipid profile, thyroid profile and BMI. 5 things we add. 2 are from B and then RBS, lipid profile, thyroid profile. Okay. TLR. Okay. 5 things we measure. So which we do not measure? Of course, we do not measure blood group. Blood group is not needed. Similarly, in NEET they have asked which of the following criteria is not included in step surveillance. Option are behavioral, psychological, physical or therapeutic. So remember this point, that therapeutic factor are not included in step surveillance. Why therapeutic factor not included? You can say that, sir, with the help of lipid and thyroid profile we can do the diagnosis. But remember, this is a step surveillance whose main work is to compare that which country has more high risk population for NCD, to compare high risk population for NCD. And high risk population for NCD, we are comparing, we are not treating them. So the lipid and thyroid profile is not done to start treatment, it is done to compare that whether India will have more high risk people or China will have it more. So therapeutic factors are not there in the basic thing. Second point is that lipid profile, thyroid profile are not done in every country, it is done only in developed country. So hormonal, biological, physical, psychological, behavioral, these are the 5 factors that we include. And remember this 5, we can use this thing, physical and psychological, 2 are from P, 2 are from B, behavioral and biological, and 1 is this hormonal factor. So benign BPH can be the mnemonic, benign prostatic hyperplasia, 2 from B, 2 from P, and then 1 is H, hormonal. So these are the 5 factor and 5 tests which we do here, do remember it. Now, which of the following is incorrectly matched? So these are some of the study which you have to know. Case report, and it's this type of question can be done by logic. Case report is, if you do the full short form, CA and RE, it will become CARE. So CARE stands for case report. What is case report? This is hospital story of one patient. Suppose you are working in a hospital as a surgeon and a case of penile fracture came, and you have written the complete thing that this case came with this much symptom, I did this surgery and then recovered, and then I said the patient go slow. That whole story will be in the case report, and case report of all the world is taken here in CARE. Then PRISMA. If you see the full form, S is for systematic review, MA is for meta-analysis. So PRISMA is comparing all the systematic review and meta-analysis which is done in the world. And observational study, if you see MOOS have this observational study in it. If you see the full form itself, MOOS is to compare the observational study. Okay, so observational study are there, like cross-sectional study and all, they are compared by MOOS. All this MOOS, PRISMA, Consort, CARE, they are the guidelines by which we compare different type of study, that which one is better, which one is not better. And then diagnostic study is something which is not done by cohort, it is incorrectly matched. So incorrectly is C. Remember, MOOS for observational, systematic review PRISMA, and case report by CARE. Coming to the next question. Oh, it is the question which we already discussed, that there were some women which were examined for 10 years and we had their past written record data. So based on their past written record data, they were asked to fill a questionnaire. So because there is only past written record data, so it is retrospective cohort. There is no future follow-up, so the answer was retrospective cohort. Okay, let's see whether there is next question or not. Yes, there is one more question. The band used for the confidence interval in Kaplan-Meier curve are. See, Kaplan-Meier survival curve, the purpose of this, the purpose is to compare survival time of two intervention. Let's say your not so good neighbor came to your house and asked that my doctor has asked me to go through angioplasty or stent, which one is better for me? And he asks you to respond. What will you answer? Angioplasty is better or stent is better? Suppose you don't know the answer. So what you can say is that to your neighbor, you can say that by looking at your face, I feel like pissing. And then go to the washroom, take out your mobile phone, and in that mobile phone, type it down, Kaplan-Meier survival curve between stent and bypass. So you will get this type of image where year of survival will be written below. Year of survival can be 1 year, 2 year, 3 year, 4 year, 5 year, let's say 5-year study is done. And this one plot, suppose it is for, this plot is let's say for this is the plot for stent. And suppose you got this plot for bypass. So if there are let's say 100 patient in both the study, 100, then 80, then 60, then 40, then 0, like let's say that is the distribution. So by looking at this plot, which one will have better prognosis? The one which is above. Stent has better prognosis. So better prognosis is by stent. But can we say that at 3 year, by bypass 40 patient will only survive and by stent 80 will only survive? Can we say it like that? No. These all are estimated by some patients, but whenever we are guessing something, there is always a range which will decide the things, and there is always a range. And this range of the survival, this range can be defined as confidence interval. Okay, like if I ask how many people will survive after 3 years who went through stent, so answer will be somewhere between 80 to 90 or 80 to 85 will survive. It cannot be that only 80 will survive. We cannot be sure in any data. There is always a range in which we answer. So how do we find this confidence interval? To find this confidence interval, we can use Hall-Wellner band. This is calculated by two methods. One is, there are 2-3 more methods also, but one is Hall-Wellner band and other method is equal precision band. So this confidence interval is in this survival plot is detected by Hall-Wellner or equal precision band. Okay, not unequal. So correct answer is D. Hirschberg is a test in opthal which we do. So this is a dummy option. And Holmes test. This Holmes is a phenomena which simply say that if there is multiple hypotheses are there, if multiple null hypotheses are there, okay, then there is more chance that we will choose wrong one. If multiple null hypotheses are present, chance of alpha error is high. Okay. So let's say I ask you to decide that there are two options, burger and salad. Which one is good for your health? Which one will you choose? So you can choose salad easily because there is only two hypotheses. But if I give you multiple hypotheses, multiple probability, like there is burger, there is salad, there is juice, there is shake, there is pizza, there is samosa and all those things. Now the probability that you can choose wrong option, wrong thing for healthy is high. Suppose you like juice more than salad. So you can say that juice will be more higher. But correct answer is salad will be the best. Juice have a more concentrated sweetener type of thing. And so better answer will be salad, but you choose juice, which is you did an alpha error, there is higher probability that you can choose the wrong option if there are multiple hypotheses. This is Holmes phenomena, but not needed for exam. So anyway, the main thing is that in survival plot, the band is by Hall-Wellner band or equal precision band. We use these two things usually to find the band. Okay. Now, which slogan is coined? This question has been asked 2 times in INI-CET exam. Do it right. This is the thing for a snake bite. What does right stand for? Right stand for reassurance. Whenever there is a snake bite, we will reassure, because 70% of the snake bite are non-poisonous. Then I means we will immobilize. Immobilize means we will not let the patient walk. Do not allow walking of the patient. Allow patient to walk by themselves to the hospital. Carry them in some van or ambulance, because if they will walk, then the blood supply will exchange and poison can also go to other places. Then GH stand for directly go to hospital, and T stand means tell about symptoms which you developed after the snake bite. Did you feel tingling numbness? Did you feel blurring of vision? All the symptom you should tell. So do it right. Do not go to quacks. Do not go to local healers. Go to hospital and tell the symptom directly. So we do reassurance, very good. We tell the sequence of event in detail after the bite to the doctor. This is also correct. We go to hospital. This is also correct. But we do not give incision, which is not done, not included is incision. We never include incision. Incision or suture or bandaging, tight bandaging is something which we don't do. Then we don't do the surgeries there. We don't disturb with the wound directly. We go and tell the doctors directly, and then anti-snake venom is the treatment. So after cleaning the wound, they will start anti-snake venom if it looks like a poisonous snake. So don't do incision, suture, all those things. Don't go to quacks and follow the right thing. This is the full form which they are using for a snake bite. So I hope you will remember it. Now let's do one more question here. They were studying dietary habit of population in the urban area in Delhi. Researchers are looking to obtain a study sample of 4,000 people of varying religious affiliation. Which sampling technique will you achieve? So cluster random sampling is good. For immunization study, we do cluster random sampling. Like if you want to know that vaccination rate is more in Bihar or in Uganda, then every time you have to choose 7 children from 30 villages of Bihar and 7 children from 30 villages of Uganda, and you will ask it from their mother whether they were vaccinated in the past or not. So these 7 children are from same village, 12 to 23 month, same village. So because they are from same village, same origin, that's why it is cluster random sampling. You are choosing a cluster of people. Stratified random sampling is for heterogeneous population. When people are different from each other, we do stratified random sampling. Simple random sampling is for homogeneous population. When population is similar to each other, we do homogeneous sampling. And systematic random sampling is when we are choosing every nth participant. For example, this question has been asked in the past also, that every first and fourth house is selected for study on use of condom. What do you think? Villagers are using condom or not these days? So if you want to do that study, rather is asking from all the villager, you can ask it from first house and fourth house. That is, you are following a system of choosing every first and fourth house. So it is systematic random. And what is homogeneous, heterogeneous? Let's say I want to know marks of the student. So rather than testing all of you, I can check any 5 student marks, because for marks boys and girls are same. You all are same student. But let's say I want you to take to a party after the class, and you all know I am happily married type of man with a 2-year-old girl child and all. But I want more love in the batches and all. Among student, I want more love. So let's say I have to choose 10 students. I will divide the class into boy and girl. I will choose 5 from boy, 5 from girl. So then you are heterogeneous, different from each other based on your sexuality. And I am dividing you, then choosing. That is strata. Strata means creating layer differences and then choosing. So that will be stratified random sampling. When you are boys and girls different from each other, that is heterogeneous, and I will choose by that. So in this story, people are different according to religious affiliation. So which will be better? Try to answer it. Out of the 4, which one will be better? And to explain it further to you, let me give you an example. In AIIMS New Delhi, when I was doing my MD, my thesis topic was on organ donation. And for that study, I did simple random sampling. There were 48,000 villagers in our study area. I just put their name in the computer, and by lottery method, any 1050 name came out. So because all were villager, so I did simple random sampling, which is the best sampling if the population is homogeneous. But in my study, there was a question that does your religion promote organ donation? And in that study, in that study population of Haryana, there were only 2% Muslim population. So out of 1000, if you take 2%, it is around 20 people. And based on 20 people opinion, I cannot tell whether Islam is promoting organ donation or not. So my whole study was unable to tell out whether religion promote organ donation or not. Why this error occur? Because I did simple random sampling. What I should have done is, in the beginning of the study, I should have said that I will take 500 Sikh population, 500 Hindu, 500 Muslim. So that is stratified, and I should have created the layer 400 of each community. And then I should have asked whether your religion promote organ donation or not. So rather than doing simple random sampling, I should have done stratified random sampling, because my question was based on whether religion promote organ donation or not. So the population was heterogeneous based on the question, they were different from each other. So I should have done stratified random sampling. So similarly in this question also, because they are different based on their religious affiliation, they should have done stratified random sampling. Okay, so that is the answer, and I hope you understand this sampling. The one last sampling is multi-stage random sampling. Multi-stage random sampling, image-based question usually come from here, is also known as multiple cluster sampling. Suppose you want to know that how many students smoke marijuana in class 11th and 12th in Delhi. So suppose this is the graph for Delhi, and any amoeba you can draw. And these are the 3 areas of Delhi. So you will choose the area first. One way is you will ask it from all the students whether they smoke marijuana or not. It is so time taking that you need to smoke it yourself if you are doing that study also. And it's so tough. So then you can choose 3 areas. From these 3 areas, you can choose 2 colonies each area. And from each of the colony, you can choose 1 school. And from each school, you can choose 30 students. So what is school? Cluster of people. What is colony? Cluster. Area? Cluster. You are choosing cluster again and again. That's why it is multiple cluster sampling. And they will give you this map, and you can ask that, sir, what is the need of doing the map? You can simply write Delhi. But they will give this type of question in the exam also. They will give you a map and then choose a small area from that. So do remember, in multi-stage, they can give you image of a map and then choose a small area from there. And multi-stage means we take the cluster again and again. And why I draw Delhi? Because if you draw wrong map of any state, the people get emotional. But with Delhi wrong map, no one get emotional. I still remember one time I was teaching in Ahmedabad, and I draw this map, this map, and people say, sir, what are you drawing and all. They got emotional there. But with Delhi, things are more cool. And I hope you will understand and remember these 5 types of sampling. One more thing they can ask is that in a study, participants were kept on adding. When we started a study, we started with some 5 people, and then participants are kept on adding. So which type of sampling is that? That type of sampling is snowball sampling. We start with 1 or 2 people, keep asking and keep increasing the sample size. It is done for HIV patient, male having sex with male study, intravenous drug user patient study. So whenever patients are added gradually, participant added gradually, that is the time when we are doing snowball sampling. Because what is snowball? A small drop of snow fall from the top of the mountain, and by the time it reaches the base, it becomes a big snowball. So the same thing is happening here. That's why it is snowball sampling, where patients are added gradually. Okay. So in this session, we are ending the session here. We have discussed the p-value, alpha error, confidence and power of study. We have discussed the sampling technique right now. We have discussed pair t-test, unpaired t-test, chi-square and all those tests, how to apply. And we have discussed a lot of screening test stats and some many other topics here. So these all information are useful not only for INI-CET exam, but for your NEET, FMG exams also. And these are because these are from the relevant questions which came in the recent exam. So I hope you all should go through it properly, and I hope this session is useful for you. Thank you, my dear friend Priya, Darsani, Yogesh, Vikas, Vishal, Balraj, Varun, Neha, Nurbano, and a lot of Vaisali, Dr. Disrespect, Sandeep. Thank you for all of you for joining the session and giving the response so well, so quickly. So, love you all. We will see you in next session. If you have any doubt, any question, feel free to ask it here. So, see you in the next session. Till then, hasta la vista, das vidania. Bye bye. Thank you so much.